Hello, my name is Gabriel Quesada from El Salvador. We're going to talk today about the small aperture IOLs after radial keratotomy. These are my financial disclosures. And as an introduction, we know that patients who have undergone a previous radial keratotomy poses a particular challenge in terms of accurate prediction of refractive outcomes post-cataract surgery. So the purpose of this presentation is to evaluate the effectiveness of a small aperture IOL in decreasing unwanted visual sensations in post-arcade eyes after cataract surgery. This is a prospective consecutive series cases, a total of 10 eyes with prior radial keratotomy in 7 patients were included. All patients had complete preoperative evaluation, uncomplicated cataract surgery, and implantation of the mask IOL in the capsular bag. The patients were evaluated at day 1, 1 week, 1 month, 3 months, and 6 months, with subjective assessments, uncorrected visual acuity, manifest refraction, and retinal evaluation, including fundus photography. This is one of the cases I want to show you. This is a female patient with cataract, previous radial keratotomy, 16 cuts per eye. As you can see, the keratometry measurements are really down, 26.9 and 30.76 on the right eye, and 32.52 and 34.94 on her left eye. This is the case that I just mentioned. You can see that the small aperture IOL goes easily through a 3.2 incision. Once we corroborate that the incision is clear, we're gonna insert the IOL in the bag, and it goes easily as any other IOL. You can see 16 cuts on that cornea. That makes it very irregular. In general, the pre-op topography was a mean of 30.9 plus minus 2 diopters. There were 13 plus minus 2 radial cuts per eyes. All patients had a significant decrease in their self-reported symptoms of glare and halos. Show you all the cases, but in general, the uncorrected visual acuity was stable through the postoperative period, and at 6 months was 20/30 plus at distance, 20/30 intermediate, and 20/40 plus at near. The combination of a radial keratotomy and a small aperture IOL allowed excellent clinical examination of the retina and fundus photography documentation, as you can see in this slide. So, in conclusion, we're going to say that in this complex group of patients with radial keratotomy with irregular corneas, the small aperture IOL result in excellent unaided vision, increased the depth of focus, and created useful pseudo-accommodation, all while decreasing the patient's self-reported symptoms of glare and halos. The small aperture IOL did not impede through evaluation of the retina with clinical examination of fundus photographies. Thank you very much.